Health Minister Dr. Joe Phaahla says today is a historic day for South Africa as COVID-19 restrictions are lifted. He says government is able to do so because of the lower rate of infections and deaths. You no longer have to wear a mask indoors and gatherings are no longer limited. Restrictions to visitors to our country have also been withdrawn. Heidi Giokos is on the story. She joins us now for more details. So Heidi, the minister obviously had to clarify the fact that he's not necessarily saying that it's over with the masks. He's basically saying the mandatory part of it is what they announced.
Yes, exactly, Maseko. And I think for the first time in a very long time, you can see my beautiful teeth and big smile because I am indoors and we no longer need to wear a mask indoors. And just to bring some context to all of this, what we do know is that the health minister indicated why government took the decision to drop the 3 remaining COVID-19 regulations, that being wearing masks indoors, the limitation on public gatherings and the mask wearing mask wearing at these public events. So what we do know is that government has said that because we have now exited what was possibly our 5th wave, there is no new variant, there is no variant of concern, there are only sub-variants of Omicron. A large majority of the population have been vaccinated, which prevents against severe COVID-19 infection. Government has decided to drop the 3 regulations, the biggest one being mask wearing. So nobody will need to wear masks indoors or outdoors or at any event moving forward. So the mandatory part has been taken away. So it's no longer compulsory. However, what the health minister has indicated, and I think this is going to be important for the public to understand, is that if there is a school or a public facility or a restaurant or old age home or any kind of facility that still feels as though they want those entering that space to still wear masks, they will have their own rule and regulation for mask wearing. But according to government, it's no longer mandatory or an obligation to be wearing a mask indoor or outdoor because they are going according to data and science, and that indicates that it's safe to no longer wear a mask. The health minister also indicating that if you are vulnerable and if you have any comorbidities or if you feel as though you are going to be around people that are at a vulnerable age or risk, for example, your grandparents or your parents or any elderly individual, the health minister says you can take your self-precaution. Let's listen to what he said about this earlier on.
What is off the table? It's a compulsory wearing of mask in certain settings, which over the last 3 months or so was only in indoor meetings and indoor settings. So that the compulsory nature. But we emphasize the fact that masks have proven to be very good in preventing, especially respiratory transmission of respiratory diseases. And we also need to maybe just add to say we would still encourage citizens, especially in indoor settings, especially where they are gathered with other people, feel free to wear a mask because it has shown, the mask has shown to be helpful in terms of preventing especially respiratory transmission of respiratory diseases, especially if you consider yourself and your practitioner medical advisor as at risk in terms of age, in terms of comorbidities like diabetes, heart disease, and respiratory diseases, chronic lung disease, having had TB, for instance, before, and all those kind of ailments. So I would want to urge all South Africans that don't feel embarrassed simply because government has said it's no more compulsory. All that you are saying is it is in our hands now to make those decisions, as also advised by our health advisors.
And Heidi, tell us more details about this first case of monkeypox that has been detected in Joburg.
Yes, so what we do know, Maseko, is that the first case of monkeypox has been identified here in South Africa, in Johannesburg specifically. We do know it's a 30-year-old male that seems to have tested for monkeypox. What we do also know is that it's an individual that has no history of travel, and the health minister saying that normally when people test for monkeypox, they might have had a history of traveling, but in this case that is not what has happened. We do understand that the laboratory services are in the process of doing contact tracing and speaking to the individual that has indeed contracted monkeypox to determine whether or not he has been in contact with anybody else and if this virus has spread at all. I think what was important to ask the health minister was, should we be worried as South Africans? Because I know it's a very different virus, it's a very different situation, but Masego, if we remember 2 years ago rather, almost 3 years ago, when we were told about the first case of COVID-19, we were also told not to worry and everything was under control. So the question was posed to the health minister, what is the situation now with monkeypox? And we do know that there's only 1% of 1% fatality rate should you contract monkeypox. So the health minister is saying, do not worry too much about this. Of course, you still need to be very cautious. It's also it's a lot more difficult and complicated to contract monkeypox. There needs to be a lot more contact with an individual that has tested for monkeypox, whereas with COVID-19, a lot of it was in the air. It was a lot easier to contract COVID-19. So let's listen to what the minister said with regards to that. But we have been advised not to panic at this stage, and we have been told that the laboratory services are in the process of trying to do contact tracing and see whether or not this has spread at all.
Late yesterday, I received a report from the National Health Laboratory Service indicating that they have confirmed through a laboratory test the first case of monkeypox in South Africa. The patient is a 30-year-old male from Johannesburg who has no travel history, meaning that it cannot be attributed to the disease having been acquired elsewhere. So it means that it is with us. So working with the relevant health authorities, a process of contact tracing started to trace the close contacts of this gentleman. Monkeypox is usually a very mild disease, manifesting as blisters on the skin. It is usually mild and self-limiting, with a very limited fatality rate of about 1%. The disease has previously been reported in African countries such as Nigeria, DRC, Central African Republic, and Ghana in the early 2000s. The current outbreak is dominated by high numbers in Europe. The UK is currently leading, just over 700 cases. Spain, just over 500. Germany, Portugal, and France. Cases have also been reported, in both cases just below 200 in the US and also in Canada. So the NICD is conducting online in-service training for our health workers, for them to be able to detect the disease so that necessary laboratory tests can be done. The disease only spread through close contacts and not through droplets. So very dissimilar, very much unlike COVID and respiratory. It's not a respiratory disease, and it spreads through contact with an infected person. That's far in terms of the history from where it has emerged. It has shown to be more dominant amongst men who have sex with men, but it just emphasizing the fact that it is mainly through very close contact. That's how it is transmitted.
All right, Heidi Giokos in Pretoria with that report. Let's leave it there for now.